Welcome to the Bio Nexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of Bio Nexus Health Podcast, Dr. Jodie A. Dashore.
Who has the next question?
Hi, Dr. Jodie, it's Huma here.
Hi, Huma.
Hi. Right, so I just wanted to ask that typically how long is a die-off reaction supposed to last?
Okay. Die-off reaction can last from 2 days to 2 weeks. And if it is, die-off is usually 2 days to 2 weeks is what we've seen so far.
Okay, and have you ever heard anyone not have a die-off reaction? Would that be normal?
Oh, yes. Absolutely, yes, yeah. There are many who sail through everything, and there's no die-off.
So that doesn't mean to say that they're not getting better. Their body doesn't react to that.
Yes, exactly, yes. So I've had several patients who don't experience die-off. So then there are two ways, and most of them we see both, is that their symptoms are getting better.
Okay.
And then we also see that that the labs that we do, right, follow-up labs, those are clearly better.
Okay, that's fine. Yeah, no, Ismail's not on any antimicrobial at the moment, but I've just joined just to get a bit more information about it.
Okay. Yeah, that was wise. I'm glad you did.
Thank you.
Hi, Dr. Jodie.
Who is this, please?
This is Rupa.
Hi, Rupa. How you doing?
Hi. Good. So you just mentioned that the die-off can last anywhere from 2 days to 2 weeks, right?
Mm-hmm.
Would it always set in within a couple of hours of any of the changes in the protocol?
Yes, it's usually within a couple of hours. If you've done not the protocol,
something new.
Wait, hold on. Sorry. If you've done any changes to the antimicrobial section, that is when you will see die-off. Sometimes I give you herbal blends in the anti-inflammatory area, in the anti-inflammatory section. Yeah. So then there's always an indication to go slow, and then there's the highlighted information that start with 1 drop and die-off is possible. Because the herbals that reduce inflammation in the brain, they have to cross the blood-brain barrier. And, it is nearly impossible to gauge the extent of infection that has spread neurologically. Mm-hmm. So sometimes the anti-inflammatory herbals can cause a die-off reaction neurologically. So yes, it's usually within a couple of hours. If you are seeing if you think it's a die-off reaction 3 to 4 days later, that is not. That is an IgG4 response that's probably diet related.
Okay. So usually with us, it's within a couple of hours. Sometimes it's within 20-25 minutes of any changes, right? So we have used the lemon juice, and then we have also used the other one, the anti-acid thing, whatever you have given us in the list.
Yes.
So if parents try that, have you seen, in spite of parents trying that, for the die-off to last anywhere between 2 days to 2 weeks? Like, have you seen that? You have seen that. What would be the reason for that? Just a sensitive kid?
The reason for that, sensitive kid becomes a generalized term. At that point, no. The reason for that is inflammation has spread. Okay. So, now inflammation has spread. Now another, I don't know, I'll try and keep it simple, but remember kids with PANDAS.
Yeah.
PANDAS is an autoimmune condition.
Yeah.
Okay. So the bacteria themselves or the bacterial proteins, meaning bacterial toxins, are the triggers for that autoimmunity. Okay. Now, autoimmunity means what? It means that your body is attacking itself.
Itself, yeah.
And in PANDAS kids, these autoantibodies go to the brain. Sometimes, I've seen autoantibodies for thyroid as well, as well as the joints. There are joint pains. There is bone pain. So it depends on where the inflammation is being channeled, okay, as the bacteria are dying off. So if the autoimmunity is triggered, the antibodies have a half-life. Now, this half-life is anywhere from 4 to 6 weeks. That's pretty long.
Right.
So when you do things like increase the binder, or you increase the lemon water for additional detox and drainage, and you add in the Alka-Seltzer Gold,
right,
all of these will help calm it down. But there's nothing that you can do to go in and stop the antibodies. It's your immune system. Modern medicine has no answer for autoimmunity. The only thing they'll tell you is, do steroids.
Right. Yeah, thank you. No, we have never faced that, thank goodness. This usually the lemon water works like a charm. So
good.
I had no idea that it can last from any day. 2 days, yes, but 2 weeks, and the explanation, it makes sense. Thank you.
Yeah, the immune system is so vast and deep and so complex. That is why, like last year, I don't know, for those of you who are not familiar, I've recently completed a postdoctoral certificate in immunology from Harvard Medical School. And I was ecstatic, when I was accepted, and I did manage to complete it, in my old age, but I managed. It was an excellent refresher course to just look at the latest advancements with the immune system. So
congratulations! You must be having 48 hours instead of 24 hours, like unlike us.
I work 7 days a week, and I'm here today. On Labor Day weekend, just know it's very rewarding to help people.
Thank you. Yeah, we are excited to for the consult that is coming up. I believe it's in November, I think. Yeah, we are excited what we have been seeing. So we are excited to share that with you when we have the consult with you. Yeah.
Yes, wonderful.
All right, thank you. Thanks.
Really happy, especially when older kids respond well.
Right.
I just love
for us, we have been waiting forever, like one step, but then 2 steps back, and nothing has been like permanent. It would just show up, and then that was it, one time only. So for us to see some of these things that we were really waiting in a 23-year-old, it's really nice, and then we are so cautious before we write down any of the points. We really want to make sure that it is indeed happening. So
yeah. Awesome. Yeah, I'm so happy to hear that.
Thank you.
Any other questions?
Dr. Dashore, can I ask you a quick one?
Yes, Ravi.
Hello.
And hold on. Which Ravi is this?
This is Ravi Ramachandran. I'm Ujjal's father.
Oh, okay. Yes.
You had mentioned earlier today in the webinar that a die-off reaction is when a system gets exacerbated, that is, a system gets exacerbated, becomes worse. I want to know whether, like in my son, if anxiety or OCD becomes worse, he's always had anxiety and OCD, but if those two become worse, is that a die-off reaction?
Yes.
Okay.
Yes. Existing symptoms get worse.
Okay. So that's something that we have noticed. So I'm just so we can associate those two with die-off.
Oh, absolutely. Anxiety and OCD are pretty much hallmark of a person with PANDAS.
Right, and that can happen 2 ways, right, Dr. Jodie? One, if you have made any changes with the antimicrobial section or the anti-inflammation section, or if he goes to an atmosphere or a place where something like an outside trigger.
Correct.
Right?
Now, yes. Now remember, again, Rupa, you make a very important point, right? Outside trigger. So when there is a new trigger or there is re-exposure, you can experience new symptoms. So this will be back to Becky, if she's listening. So if there is a new trigger or an old trigger has come back, you can get new. Say, for example, right? We are still we are just building up on detoxing the mold and killing off the triggers. But then before the old, old stock of mold in the body, right? Before the old levels of mold toxins in the body are out, you introduce a whole new exposure. Now, because of that, because the body hasn't seen this level of toxicity, it is quite possible you may see a new symptom.
Right, but that has been, you would still call it as die-off, but it has got nothing to do with the protocol changes because
No, it's not die-off.
Changes. It's
No,
an out,
it's
yeah,
not.
exactly, right? You
It's
cannot
not
call it as
die-off. Wait,
right.
No, it's not die-off. It's re-exposure.
Right. I mean, what I meant was, I'm sorry, not the die-off. Even though the symptoms are the same, whether it's anxiety or OCD, which are the existing symptoms, but it is not a die-off because it's an outside trigger.
Correct.
Thank you.
Correct.
Right.
Yes. Outside trigger will mean that, keep track of that. And at the next appointment, I will either add something or increase the dosage because now there is more, outside toxins, outside triggers that have entered the body.
No, we just avoid that place. We don't take him to that place at all.
Perfect.
I have one more question.
Yes, Sudhi.
What is the best way to control the die-off reaction? For example, my daughter, I tried to put her salt, what's called Epsom salt.
Epsom salt bath. Yes. Excellent.
Yeah. But we have a problem for that one. If I put her 2-3 times a week, her breath is getting like kind of garlic or something looks like garlic.
Oh, she's getting heavy detox. Okay, so if you put her in the Epsom salt bath 2-3 times a week, you are smelling garlic breath.
Yeah.
Okay. Right. So what else can you do? Okay, so you will see.
Yeah. I tried also some people saying what's called, let me see. This one.
Apple cider vinegar. Yes. Okay.
Yes. But that one I scared since she has a high phenol.
High phenol issues. Okay.
Yeah.
Well, no, apple cider vinegar is not really a detox remedy. I mean, I know there is lots of, apple cider vinegar is not, apple cider, that's what I was trying to say, that apple cider vinegar is not usually recommended by me as a die-off remedy because I haven't seen consistent results with that, right? So Epsom salt bath, if the whole bath is causing too much detoxification, then you can just do, soaking her feet.
Oh, okay.
And, just go through the list of things that you are given in your instruction sheet as to what to do when there is die-off reaction, right? Meaning
purification is causing any other damage or that's fine?
Wait, so that's a whole separate question. Wait. So first, let me finish this. What you asked me, what to do for die-off, right? Okay. So increase Epsom salt bath, increase the binder, obviously immediately reduce. You have to keep track of which one caused the die-off. So that one, say for example, V-blend. So you will stop the V-blend for a few days and then reintroduce it with maybe, 1 drop. And then, if you are increasing 1 drop every 2 to 3 days, maybe that was too much. So then you just increase by 1 drop once a week. So I've had that happen to many
We
people
don't have
as
a
well.
we don't have a problem for the supplements. The only time I put her irritable in the bathroom 2-3 times a week. She having smelling on her mouth.
Okay, yeah, that's what I'm trying to give you an option for. Okay, if you don't like the garlic smell detox, then just soak her feet in it, or go to the other options, you know, to handle any kind of die-off reaction. In your protocol, it is yellow highlighted. You must have seen the other options, right? You have to reduce the drops, you know, you should increase the binder, slowly add the drops back in. You can try dry brushing, you can try lymphatic drainage massage, there's lemon water, there's Alka-Seltzer Gold, right? All of these, but you know, bottom line is die-off is a great thing. It's a very good thing, which means that the herbs are doing what they are supposed to do. The labs are accurate. And you know, the biggest reason for die-off, I mean, labs are accurate, meaning that at identifying what's going on, right? Because usually it is very hard to tell us that, you know, what is the amount of infection? So based on the symptoms, based on the labs, I calculate a customized dosage for each patient. But, you know, the amount of infection may be a whole lot more. So when you go in with just 1 or 2 drops, you see this, you know, big blow up because there is a whole lot more going on than what really showed up in the labs because of immune compromise. Okay, now, another question that Sudi asked was, is die-off reaction causing any harm? No. There's no harm being done. It is a good thing. You know, it's the infections that are causing the harm. Remember, infections have to be killed. Whatever method you want to use, you know, you want to use traditional methods, you want to use herbal remedies, you know, you want to go and try antibiotics, whatever you choose to do. Remember that all living organisms have a reproductive cycle. They grow. So bacteria, viruses, yeast, fungi, parasites, they have a reproductive cycle. They will keep growing until we are able to kill them off. So, you know, I would keep that in mind when it comes to die-off reactions, that you know, these infections have to be killed off. They are major triggers for what's going on in your body, you know, all of the symptoms that you're getting. All right.
you.
You're welcome. My pleasure. Who else?
Hello, doctor.
Yes.
Hi, this is Hannah, Rudy's
Hi,
mom.
Hannah. Yes.
Hi. So basically, I have been on full protocol for the last 1.5 months. And we kind of, you know, that our history that we've been on anti-parasite, antimicrobial protocols for a long time, you know. So now the thing is that we got to a place where she no longer have certain things, but now with the protocol, she is like, there's a lot of things that is coming back, you know, like sleep issues is there, like the pica, like she goes on eating tissue papers, or she goes on eating the plants, the biting of her shirts, especially after the enhancer. So that, I mean, I'm a little confused. Is it now I'm concerned because you said it should not last more than 2 weeks. That's one. And then I have always experienced that whenever there's probiotic or prebiotic, she goes crazy. So I am wondering, is this happening because of the die-offs? Because
are you on any antimicrobials?
Yes, I am. Yeah. We have been on full protocol completely.
You managed to reach, okay.
Yes, yeah, we have followed all the steps, and I'm handling it, but I'm a little concerned at the same time because the OCD is back. So many things are back, and especially the sleep issues. And she would wake up at 2 3 a.m. and I would wonder like, what is happening now?
Right.
So I want some assurance. Is it an indication that something is going on? Like, as you mentioned, it could be PANDAS, or is it a die-off? And it will eventually.
Sana, yes, I have explained die-off like several times today.
Yes.
I mean, I'm happy to do it again.
No, that's
it's
exactly,
just, I mean, Sana, wait. So this is up to you to keep track of which herbal has caused what response. So perhaps you can book an appointment and we can go over it step by step, right?
Yes.
Especially if it is, if it has been lasting for a very long time. Remember again, we need to ensure that she is in a clean and clear environment. We have children, who are still in carpeted rooms. We have people who are still living in a non-remediated moldy environment.
Yes.
Okay. So that is continuous daily exposure. We have children that go to school and the school either has their head buried in the sand, they don't want to hear it, and that's where the exposure is. Special needs classrooms have many sick children that are carriers of strep and mycoplasma, and you have a child or a person being exposed to those on a daily basis. Okay, so if this is going on, that is where you will see, extended. So it is like it becomes a mishmash of thinking it's die-off, but it's actually exposure every day.
The problem is sometimes you can't, when the environment is, you are in an environment where there's AC and there is a mold everywhere, then becomes a challenge. The GCC countries, they all are like, you go to malls, you go to play areas, it's all it's all molds. Sometimes you can't just help it. You go to pools, which is same problem. And then you're
chlorine issues. That's right.
Correct. Yeah. You're like, the child needs to have a life as well and some entertainment, but then sometimes you can't help it, Now I can control my house, but sometimes I can't control all the environment, That's the problem. Like when you are in an environment where there is more chances of exposure than other places, you know what I mean?
It is up to you to avoid those places. Okay, it is important to make those sacrifices for as long as it takes for the labs to come back to normal. Okay, so the best way to judge if the treatment is working is, number one, symptoms, or equally important, the labs getting better. So at follow-ups, when we see that labs are looking better, but the symptoms are not looking better, then it's pretty clear cut that there is re-exposure. And yes, I know you're saying that you want to have a life, but most of us haven't had a life for many years, trying to get rid of, PANDAS, all the triggers. So that pretty much just goes with the territory. Now, if your child if you feel that she cannot tolerate herbals, then it's absolutely fine to just, try another protocol. Maybe herbals is not for her.
The question is just like about trying to investigate what could be the problem. So if it's die-offs, then yes, I can bear with die-offs. There's no problem at all. I have experienced it before and it should not be a problem, but I just wanted the assurance that it should not be extended more. As you said, it should not be more than 2 weeks. It should not be more than, that's the max.
Correct. No, it's not the max. No. Yes. No. It's usually from 2 days to 2 weeks. See, listen, there are no absolutes in what we are dealing with.
Mm-hmm.
Okay. There is no guarantees and there is no absolutes, simply because of the huge differences in each child. Right.
Correct.
Whatever prior treatments you've done, you have seen your child's labs. Wait, have we had a lab review?
No, not yet. It's soon. We are.
All
we are
right,
gonna
so
have.
let's wait for that is what I would
Yeah.
recommend. I think we'll get a whole lot of answers as to what is still going on. You have been given a protocol based on existing symptoms and prior labs that we looked at, and she's been given a protocol. Now,
Correct.
when we look at something that is happening now, right, current labs, so then we can tweak the protocol accordingly. And in the meantime, Hannah, what you need to do is simply follow the plan for die-off. Remember, I explained autoimmunity and PANDAS. If there is
Yes.
re-exposure and that re-exposure is triggering PANDAS, you can expect 4 to 6 weeks for the antibodies to fall. That is the half-life of antibodies.
Yes.
Right?
No, we are
So-
doing everything. We are doing the bicarbonate of soda shower, Epsom salt. We're doing the binders. I mean, we're
Right.
following everything. I mean, I just
Excellent.
hope it gets better. Thank you.
Excellent. Well, no, if there is re-exposure, it is not going to get better until that exposure is stopped. So if you would
Yes.
like to watch, my re-exposure video, that might be helpful for you. It is very important to, get rid of triggers, because there is no magic pill which can just, remember, the protocol is trying to eliminate past issues.
Mhm.
It is not possible to kind of, predict what the exposure will be. And if there is increasing toxins coming in every day that is above the bandwidth of the protocol, then it'll be very hard. So once again, let's look at the current labs and compare them with the ones, prior to seeing me, and see where she's at.
Sure. Yes.
Right, so we can
Thank you,
quantify. Oh, you're most welcome. Right, now remember to keep track of which supplement or herbal is causing any problems, and by all means you can stop that for a few days.
Okay, I'll try. Yes. Makes sense. Thank you.
You're welcome, of course. Good, so we are almost done, right? We have 10 more minutes if anyone has any last questions.
Join us next week for part 3. Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the Bio Nexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.